At Memorial, our autologous bone marrow transplant program brings hope through experience, precision, and world-class expertise.
Hello, good day. I am Dr. Emre Tekgündüz. I am the head of the Adult Hematology and Transplant Unit at Memorial Bahçelievler Hospital. Today, I would like to share with you the fundamental aspects of autologous stem cell transplantation, which is an important topic. As you know, hematopoietic stem cell transplantation is a form of treatment that we use for a variety of indications. If the donor in this type of transplant is the patient themselves, we call it autologous. If we use another donor, such as a sibling or an unrelated donor, we refer to it as allogeneic stem cell transplantation. In hematology practice, autologous stem cell transplantation is most commonly used in lymphomas and multiple myeloma. But in some cases, patients with rheumatological diseases, neurological diseases, and certain selected solid tumors, essentially diseases within the field of oncology, can also benefit significantly from autologous stem cell transplantation. When starting this process, the first thing we consider when a patient is referred to us is whether they can truly benefit from this transplant modality. In other words, is this a treatment we would recommend if it were our own relative? We check whether there is an indication for it. But that's not enough on its own. The patient's performance status and whether they have any serious comorbidities are all evaluated. And again, the patient's response to treatments received prior to transplantation are all factors that influence our final decision. Once we decide to proceed, our next step is hematopoietic stem cell mobilization. This is the stage where the stem cells residing in the bone marrow are mobilized into the peripheral blood and collected, because everything depends on this. For this, we administer an injection to our patients once or twice a day, depending on our preference, for 5 to 7 days. During this injection period, patients may experience mild complaints such as bone pain or joint pain. When we reach the 5th day, if our patient's veins are good, nothing else is needed. But for patients whose veins are not good, meaning you can't draw a high volume of blood, we may need to insert a small tube called a catheter into the main veins. As we move forward in this transplant process, we check the amount of stem cells on the day we will collect them. If the amount of stem cells circulating in the blood is sufficient, then the chance of successful stem cell mobilization is high. Then we place our patient on the apheresis machine. On the apheresis machine, all of the patient's blood is circulated through the machine over 4 to 6 hours. The stem cells are separated and the rest is returned to the patient. At the end of this procedure, we count the cells again. Once we are sure that we have collected enough cells for the transplant, we freeze them by adding certain special substances to preserve their viability. After freezing, depending on clinical necessity, we may wait sometimes a week, sometimes 3 weeks. In the meantime, we carry out our evaluations. In other words, does the patient have any serious heart problems, liver problems, kidney problems, or respiratory issues? All of these are evaluated. We determine the risk of encountering a serious complication during the transplant. After all these steps are completed, we admit the patient and, if possible, a companion to our transplant unit, and the transplant process officially begins. During this transplant process, our patient undergoes an intensive treatment called a conditioning regimen, which is designed to eliminate the primary disease and may include chemotherapy and sometimes radiotherapy. After this intensive treatment, while the cancerous cells are being destroyed, the patient's healthy, normal stem cells are also eliminated. So what saves our patient at this stage? Stem cell transplantation. In other words, we thaw the stem cells that we previously collected and stored from the patient and then administer them back intravenously. This process is no different from a standard blood transfusion. After that comes the patient's supportive care. Until when? Until the bone marrow starts functioning. Stem cells are quite smart. They immediately go to their niches in the bone marrow and start multiplying and producing normal blood cells. This process roughly takes about 2 weeks. During this period, any potential need for blood in patients is met with transfusions. And if an infection occurs, appropriate antibiotics are given. In other words, this is the supportive care phase. And finally, when the bone marrow is functioning well, all of our patients' problems have resolved. They are eating normally, are mobile, and are able to take their medications orally. At this point, we discharge the patient to be followed up in the outpatient clinic.